This is Dr. Kent from mychronicpain.com, and I'm presenting the best pain doctor for you. We're focusing on chronic pain doctors, but these principles apply to all healthcare providers. And yes, it's get the best pain doctor for you, 5 tips plus 1. I know that's 6, but the last one's kind of special, so I wanted to bring it to your attention. A famous Rolling Stone song said, get what you need. Well, I'm going to tell you to get what you need too. Get the doctor you need. If you're not sure what that is, ask other patients that have similar symptoms. Ask professionals. Pharmacists are very good. You may need a specialist like a rheumatologist that treats arthritis. You may need an orthopedist for joints. You may need a rehabilitative doctor that's chronic pain, an anesthesiologist that specializes in pain, a neurologist that does neuropathy and migraine. You got to find out what you need first, and then you're going to check in on their experience and training. Now, doctors that are young tend to want to use their training right away, and they're really aggressive. As doctors get older, they become a little better, and as they get up there in age, sometimes they're a little less into the new things. So be careful. And what I would say is get a combination of training and experience if you can. Make sure your doctor feels comfortable with everything you need: medicines, techniques, referrals. Make sure that they prescribe narcotics if you think you need them, because a lot of doctors aren't prescribing them now. The doctor is only as strong as his team, the team of professionals he works with. So make sure you check on the team, the office manager, the nurses, physical therapists if they have it, psychologists if they have them. Check on the team. Make sure that they're good too, because a doctor's team is his major resource. Next up, comfort and trust. Do you feel comfortable and trust your doctor and the healthcare team? Can you work with them? You may not feel good at first because it's an overwhelming task to manage pain and work on your disability and restoring your function. It's natural to be nervous and anxious at first and feel that it's all new, but so once you settle down, can you work with this provider? That's something you'll have to find out. Now, to me, the most important thing is communication. Can you communicate with the doctor? Will he listen? Communication is a key point in good care. You must be able to tell him the story, tell him your story, ask questions, and get answers. All right. Next one, very, very important. Can you communicate with the team? Can you communicate with the doctor? Will they listen? Will they answer your questions? Will they hear your story? Can you get answers? Can they get enough time to explain diagnosis, therapy, and changes in medication? Communication may be the most important thing. Now, doctors need to be available, or someone in the healthcare team needs to be available to you. Can you get a hold of someone? Do they respond to the pharmacist? Are there slots open for you to be worked in if you need be? Do they answer the phone calls? They need to respond to you, so that's all to availability, okay? If your doc's not available, then you can't communicate with the team and the doctor, of course. Now, next is open-minded. This goes to a doctor that not being judgmental, not being single-minded in what they do, and being able to communicate with you again. If you want to discuss a new therapy, they'll be glad to discuss that with you, like exercise, physical therapy, chiropractic. If you're interested in new techniques, they'll keep an open mind and they'll explain their position and they'll listen to your opinion, because your doctor needs to provide you with guidance, not be judgmental, not be paternalistic. No one knows everything. You need to learn how to manage yourself, and you need to learn how to manage your problems as a team with the healthcare team. Don't be afraid to discuss things with your doctor. Fear propagates chronic pain. Now, remember, the doctor may have a good reason not to use some of these new devices, new techniques, and new medicines, because they're higher risk and we don't know sometimes what they're going to do to people. And remember, the doctor probably has been hearing about this for like the last 10 years as it's been in research and development. So what's new to you is not necessarily new to them. And that leads us to the plus one. You don't have to like your doctor. You don't have to like him or her. The relationship is professional. It's nice if you like them. It's nice if they're funny. The more important is respect, trust, feeling comfortable, being listened to and being able to listen to them, overall communication with the healthcare team, availability, and their ability to work with you and help you in the task of managing your pain. Well, come visit us. Ask for a blog at mychronicpain.com. I'm signing off. This is Dr. Kent. I hope today is a better day for you.